Early stage of postoperative scar formation, laser correction, to be or not to be. I work in a laser cosmetology and plastic surgery clinic, which is why patients with early postoperative scarring are often met in our practice. Regardless of that, there are no standardized protocols for managing early postoperative scarring. According to data from World Health Organization, pathological scarring forms in 4 to 10% of the patients after surgery. When a person comes for beauty, rough scars after aesthetic operations are a difficult problem. It strongly affects the psychological status in the personal life. This reduces the patient's satisfaction of the intervention, which exhibits itself in the final result. In the admitted and existing recommendations of plastic surgeons, laser treatments are still considered experimental and do not hold enough sufficient evidence.
Относятся к экспериментальным, к методам, которые не имеют достаточной доказательной базы.
Only after a year can a patient with postoperative scarring be taken for treatment. Surgeons manage this, seeing as they have such recommendations. In the presence of hypertrophic growth tendencies, glucocorticosteroids is applied, as they are among the recommended methods. In this case, the physician administered the glucocorticosteroids. After some time, atrophy was formed. We can't say that we achieve good aesthetic results. Atrophic scarring is even harder to correct. It's easier to correct hypertrophic growth when it has just begun. Today, there is a tendency that applying laser treatments in the early postoperative period positively affects the end result and optimizes the scar.
Очень хорошо сказывается на конечном результате и оптимизирует получаемый конечный рубец.
The criteria for choosing a laser therapy method for immature postoperative scars remains insufficiently studied. The optimal timing to start therapy is unknown as well. Moreover, we can trace the tendency for pathological scarring for 1 to 2 months of postoperative period. Clinically, this starts to manifest in excessive proliferative activity, itching, intense redness, excessive tissue volume with heightened scarring over the surrounding skin, compaction of the scar tissue, rigidity and tissue surface tension. Early laser treatment is aimed at preventing the development of this pathological process in the very beginning of its development without waiting for the pathological scar to form. Early application of vascular lasers should be aimed at correcting hypervascularization because it's the one that supports the inflammatory elements in the tissues. Inflammation, in turn, stimulates the fibroblast activity, which completes the pathological cycle. Well-studied mechanisms of vascular lasers actions. It's shown here that not only does vessel coagulation in the scar, a decrease in fibroblast activity, collagen degeneration and apoptosis of the fibroblasts occurs. Clinically piloting researches were conducted on the basis of our clinic. The research's goal was to evaluate the results achieved in the early laser treatment of immature operative scars with abnormal fibroproliferative processes activity with the use of two-wave vascular laser system, neodymium KTP Q-switch Multiline. Research period 9 months. September 2017 to May 2018. The studies were conducted on the basis of the Linline Laser Cosmetology and Plastic Surgery Clinic. The ethics committee gave the green light, and the informative agreements were signed. The patients participated in the research had immature scars for a period of 20 to 90 days after the plastic surgery. The presence of at least one clinical symptom would assert there was a tendency to hypertrophy. In addition, patients mustn't have infectious complications. The research team consisted of 18 people, 15 females and 3 males. Average age was approximately 50. Skin phototype was 2 to 4. Localization of scars, the face in 14 people, abdomen and chest in 4 people. The average time period between operative intervention and the initiation of laser therapy amounted to 36 days. All patients applied prophylactic methods prior to the laser therapy, application of silicone gels and bandages for the body. The neodymium YAP KTP laser with 2 wavelengths, 1079 and 540 nanometers. The combination of 2 wavelengths allows us to actualize the clinical effect on 2 levels at once. This is to work out the vascular component of the entire length. For 3 millimeter radiation parameters, the power is selected individually up until the vessels start to darken. Duration of the wave train is 2 milliseconds. Q-switch laser was supplied as a package. The mechanism is photothermal, despite the fact that it is a Q-switch laser. Treatment protocols consisted of 3 sessions of laser therapy within a time period of 2 weeks. Laser therapy was conducted without anesthesia, and the treatment was carried out in scanning mode. If we were working in the eyelid area, we used keratoprotectors. Recommendations after treatment: avoid vaporizing procedures, exposure to ultraviolet radiation. Do not injure and avoid rubbing against tight clothes. Patients reported good treatment tolerance. The effectiveness was evaluated on 2 scales: scale assessment of a patient's scar and the dermatological index of life quality is observed. Ultrasound scanning of scars were also performed. The assessment was conducted 4 times, prior to the start of treatment and before each session. According to 3 patients, scale after 3 sessions, clinical indicators such as itching, color difference, and thickness showed the greatest dynamic. All in all, we achieve a good positive dynamic. On the observer scale, the indicators were about the same. Here we have hyperemia, thickness relief. Patients with lower point indicators had the best outcome after the end of 3 sessions. Patients that came to us later with more severe clinical symptoms had a higher initial assessment on the scale. They required more treatment sessions, which went beyond the scope of the research. To get a clinical result, treatment must be long-term.
Требовала большее количество процедур, то есть она выходила за рамки исследования. И таким образом, для того, чтобы получить клинический результат, мы понимаем, что лечение должно быть более долгосрочным.
There was a positive dynamic of the index and assessment of life. Results after 3 sessions of laser therapy with the use of the vascular laser. 89% of the patients reported significant improvement. 11% reported good improvement after 3 sessions.
И 11 отметили хорошее улучшение после 3 сеансов.
We can also notice positive dynamic on the ultrasound pattern, which is reflected in the echogenic density decrease, as well as a decrease in the slip zone. Clinical examples. This is a patient after blepharoplasty. We can see that she has a tendency for hypertrophy. Next, we see the outcome after applying a vascular laser 3 sessions. These patients are treated on a mandatory basis with keratoprotectors. The eyelid area can't be treated in any other way using this laser. Another example of an also positive dynamic after 3 sessions on the vascular laser. One more blepharoplasty. A bit more time has passed here. 42 days after surgery. Clinical symptoms are moderate. 54 days have passed after the surgery for this patient. Clinical symptoms are moderate, but there are fewer intertemporal changes. This is a patient after abdominoplasty. A tendency for hypertrophic growth exists. Here, the clinical symptoms are quite severe, and the intertemporal changes are reduced. Another patient after an abdominoplasty. A good scar with a tendency to keloid has formed.
Рубец как минимум гипертрофический, с тенденцией даже к келоидному, вы видите, да, вот этот маленький рубец, и очень высоко возвышался.
We are able to stop the growth, and a regression of scar tissue started. This is a patient after a mammoplasty. Conclusions. Early exposure to vascular laser allows you for controlling the intensity of the fibroproliferative processes in the scar tissue and prevent the formation of pathological scars. Treatment should begin when the first symptoms appear. The use of the 2-wave laser system in the early stages of an immature postoperative scar showed high efficiency. Early laser treatment had a significant impact on patients' quality of life and overall satisfaction after surgery. This method can be recommended for further practical use. Continuing the research of laser treatment in the early postoperative period will optimize treatment algorithms and outcomes.
Как раз нам позволит оптимизировать алгоритмы лечения и исходы. Спасибо большое.